The final discussion that we're going to have about the appendicular skeleton is the lower extremities, starting off with the superior portion of this extremity, discussing about the pelvic bones. But before we begin, I do want to note and make certain that you note that this sacrum, this backbone right here, as well as the coccyx that's dribbling off of it inferiorly, aren't included in this appendicular skeleton. It is part of the axial skeleton, but because of the nature of how they interact, we do need to discuss them in part. As you will see that there is some chat about true and false pelvis, but we'll be talking about that later to hopefully get that thing through. First, we really need to discuss the three bones of the pelvic girdle. We have ourselves an ilium, which is the upper portion. If you were to go get grumpy and you put your hands on your hips every so often, this is what you're putting your hands on. This is the ilium. It has a ala, which means wing in a lot of Latin-based languages. If you're putting your hand on that hip still and you're noticing at the tippy top there's this 90-degree point, that is the anterior superior iliac spine, and it is continuous or a part of this iliac crest. That anterior superior iliac spine is that 90-degree bump that you feel back there. If you were to continue going backwards, you would eventually end up at a dimple in your skin, which is also noted by the posterior superior iliac spine. That is the posterior superior iliac spine and the anterior superior iliac spine are the beginning and the ending of that iliac crest. You will note that it is a large portion of your pelvic girdle. The other two parts that have some role is that ischium and the pubis. The pubis, I'm assuming that most of y'all know what the pubis region is, the pubic region is. It's that anterior portion. It has a little bit of a bone underneath that hair. It is also the site of where you're actually going to get something called a pubic symphysis, which is a cartilaginous joint, which allows for stretching, especially during childbirth. Underneath that, connecting to the ilium and the pubis, is the ischium. One major thing to know is that ischial tuberosity. You can feel it when you sit down, and it is the main point that touches the chair. And when somebody is a jerk to you and sits down really hard on you and they have a bony butt, they literally have a bony butt. It's most likely that ischial tuberosity that you're feeling. A couple of things to note really quick is also to notice that they do all participate in this acetibulum. The acetibulum is this indentation which receives the head of the femur. So the ischium, pubis, and the ilium all participate in this acetibulum. Something else to know, we're getting back to that true and false pelvis thing, is that these bones, both the ilium and the pubis, are all in this upper portion of this bowl up above, or a part of it, or at least parts of them are above this pelvic brim. Now what's so special about that pelvic brim is where you divide your false pelvis from your true pelvis, aka your superior portion of your pelvis from your inferior portion of your pelvis. The false pelvis, if you follow around that pelvic brim, includes a good portion of your ilium as well as a portion of your pubis, while that true pelvis does indeed contain your sacrum, a very tiny amount of your ilium, but also a good sum of your pubis and all of your ischium. Do notice that the true pelvis does include a lot of that bowl where a lot of your outlet occurs. Urine for females, defecation for both genders, and that vaginal opening for females. There are, because now we've mentioned male versus female type of thing, we should point out at this point, the differences between the male and female pelvis. This is what, when somebody is doing a crime scene, they can determine if it's male and female rather quickly. First off, the outlet that you got going on in males versus females is vastly different in size. Males, well, they're not concerned with giving birth. So a lot of those intestines, a lot of those things is given precedence to make certain that they don't sort of splotch out, so that opening isn't as open. That sounds awful, but I'm going to go ahead and run with it. The female's opening, it's a lot larger. It makes sense. During childbirth, you do need that opening to allow that to happen. Males' bones, you're also going to notice, are a little bit thicker than that of females. Another major notation, last two major notations, is this pelvic arch. The pelvic arch in males is much sharper in its degree compared to that pubic arch in females, approximately about 90 degrees. Finally, you'll also notice the orientation of the sacrum in males versus females. The males is projecting more anteriorly when compared to that of the females. There's a little chart for you to help you out with that pelvic girdle. Let's go ahead and move on down into that region, the rest of your lower leg. So remember that acetibulum? Well, the acetibulum indeed takes on the head of that femur. The head of the femur goes into that acetibulum. Just below that is the neck of the femur, and just distal to that as well as the greater and lesser trochanter. This is the anterior view. You'll see that this greater trochanter is the most lateral aspect of the femur, with the lesser trochanter being more medial and posterior to that of the greater trochanter, and inferior as well. Now this is the only place that you'll ever see a trochanter. This is the only bone that you'll ever see trochanters. Remember that trochanters are those large projections. If we go down that femur a little bit more, you'll notice a gluteal tuberosity. Remember that tuberosities are rough. If you remember my rule of thumb, if something is rough, most likely it is receiving some type of muscle. And in this case, if it's the gluteal tuberosity, you can bet your bottom dollar it's going to be some of the gluteal muscles. Migrating down, you'll see at the very bottom, we've got some condyles and epicondyles of the femur. Epicondyles, again, being that rough patch that allows for some insertion points of your muscles, or maybe even anchor points, and the condyles being more closer to that of your articular surfaces. One last important thing to note about femurs is that it is one of the strongest bones in your body. Considering that all the mass and weight that's going on it, plus the angle that it's at, this bone has to be extremely strong. Migrating down more distally down the leg, we have our only sesamoid bone, the patella. We don't need to know much about that. Just know that it has some role in the joint stabilization. Don't need to know base, apex. Just remember that it's a sesamoid bone. It looks like a seed. Finally, let's go just a little bit more distally. We got ourselves the tibia and the fibula. The tibia is the one that bears the most weight. You would think it would also be the strongest, but it is the femur that's the strongest, but the tibia is the one that bears the most weight. It makes sense. It is the lowest bone, one of the lowest bones in your body, long bones of your body, and it accepts that pressure a lot. The fibula is there as sort of a little bit of a helpmate for it, but more of a supporting role. Again, you'll notice that the tibia, that you have some condyles and no epicondyles really. Epicondyles are kind of bulging out over here. If you go back to the femur, you do have an important marking right here that you can actually feel pretty easily. If you feel that the more proximal end of that tibia, is that lump, that tibial tuberosity. That region there accepts a lot of muscle, a lot of important strong muscles. Migrating downward, you'll also notice that your ankles actually have an appropriate name for it. It's called the malleolus. The one that pertains to the tibia is the medial malleolus, and the one that pertains to the fibula is the lateral malleolus. How you remember the orientation of the tibia versus fibula really quick. It has a little mnemonic here. The fibula is lateral. The fibula is lateral. So you just remember that lateral malleolus is part of that fibula. I am going to point out the tarsal bones here really quick, the talus, calcaneus, navicular, the three cuneiforms, and the cuboid muscle bones really quick. Let's go ahead and just switch over to the picture real quick. The two major ones that probably that you are familiar with, or at least have been made familiar once upon a time, is the talus bone here. That, if you can notice, it has a lot of that articular cartilage on it. It receives the weight and the bear that of the tibia and the fibula. And then you have the calcaneus, which, if you notice, it's quite rough, and it does receive a lot of the muscles, especially the posterior portion of your legs muscles. Going into more talus bones, we got ourselves this little nice mnemonic here. Tall centers never take shots from corners. Tall talus, calcaneus centers never, navicular, take, where we go, I take third cuneiform, shots second cuneiform, from first cuneiform, corners, cuboid. Continuing down those bones, we got ourselves the metatarsals. Kind of seeing a relationship, hopefully. You got carpals up in the hands, tarsals down in the feet, metacarpals up in the hand, metatarsals down in the feet. Hopefully that connects. And then finally, just at the base, the more distal portions of those metatarsals are your phalanges and the bones that pertain to them. You'll notice that even in hands, you have 14 bones in total for each foot for phalanges. The foot does have arches to it to help, all of which are supported by ligaments and tendons to help with motility. If those do break down, you're going to end up with a flat foot, which will not end very well for you. With that, that is actually the end of our discussion of the bones. Thank you very much. Remember, you got this.